Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. The Invos monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on the utility of the Invos system. Does melanin influence measurements for a 2-wavelength system? To help answer this question is Eli Coleman, Senior Research Manager at Medtronic.
Skin pigmentation is another component of superficial tissue that can influence the performance of NIRS monitoring. It needs to be well understood. In this section, we will cover how melanin may influence measurements for a 2-wavelength system. Melanin is significant in NIRS monitoring as the main optical absorber in the superficial tissue. So, any signal from the superficial tissue that hasn't been well removed is likely to be impacted by this absorber. Melanin will absorb more or less based on the concentration. The graph here is the absorption spectrum for melanin across different wavelengths. Within the region where NIRS is implemented, darkly pigmented skin or skin with more melanin, shown with the red line, will absorb more than lightly pigmented skin, shown with the blue line. Just as before, we can consider our 2 wavelengths of light passing through light and darkly pigmented skin. In the case of darkly pigmented skin, as shown on this graph, the red light will be attenuated more than the IR light. However, lightly pigmented skin has relatively the same amount of absorption for both red and IR light. So, melanin in the superficial tissue can compound to the attenuation already expected by the tissue hemoglobin, if not adequately canceled out. The 2 light sources first pass through a medium with a set amount of melanin, and then through blood with changing amounts of oxygenated and deoxygenated hemoglobin. Let's first take the case of a darkly pigmented individual with highly oxygenated blood. In this scenario, the absorption due to melanin sits on the red curve on the left, meaning that red light will be more attenuated than IR. From the perspective of blood oxygen saturation, absorption sits on the dashed red line on the graph to the right. This means that IR light is being absorbed more strongly than the red light. This reflects the true absorption that we care about. As stated in earlier sections, oxygen saturation is correlated to the difference of IR light to the red light, L minus A. However, when we add the impact of melanin, the difference between IR light and red light becomes less pronounced. Now, that difference between IR and red absorption corresponds to a state of lower oxygenation on the absorption curve. Without understanding the contribution due to melanin, the reported value of oxygenation will be underreported for darkly pigmented individuals. For lightly pigmented skin, melanin absorbs both wavelengths more equally. So while the overall attenuation is greater than if the superficial layer were completely removed, the relative difference between IR absorption to red absorption is not significantly impacted. Here, even without understanding the contribution due to melanin, the reported value of oxygenation will not likely be affected. Melanin can cause a bias in oxygen saturation measurement not accounted for or canceled out. However, it is also important to note that melanin concentration within an individual is constant, unlike the balance of oxygenated and deoxygenated hemoglobin, which is dynamic. This means that the contribution of absorption due to melanin does not change as blood oxygenation changes. So when measuring how much oxygenation of an individual has changed, the contribution of melanin is canceled out. That's regardless of whether that individual is darkly pigmented or lightly pigmented. Takeaway here is that melanin will change the initial RSO2 for the patient, but the change in RSO2 or trend would not be influenced by melanin if the signal contains contamination from the superficial layer. If we think back to the basics of spectroscopy and Beer's law, we needed to incorporate two wavelengths to solve for understanding the concentration of two different concentrations of molecules, oxygenated hemoglobin and deoxygenated hemoglobin. To account for a third concentration like melanin, we can employ a third wavelength to characterize its influence. However, the choice to include additional wavelengths needs to be weighed against any potential impact on the entire system to meet its overall performance needs.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.